From the 2013 National Conference for Health Communication, Marketing, and Media in Atlanta, Georgia, welcome to the National Public Health Information Coalition's live webcast from the exhibit hall at the Hyatt Regency Hotel, featuring CDC's Associate Communications Director, Kathy Lyon-Daniel, NPHIC President Robert Jennings, social media expert Valerie Daniel, NPHIC members Tom Slater, Laura Taylor, Karen Terrell, and more. This webcast is brought to you by NPHIC, dedicated to making public health public. Well, hello everybody. This is Kerry Shearer from NPHIC, and right now we are here in the exhibit hall at the Hyatt Regency in beautiful downtown Atlanta. Thank you very much for tuning in to our live webcast. It's great to have you here. It's great to see that actually everything appears to be working now. And I wanted to introduce you to our wonderful panel of panelists who are here and are going to hang out for the next hour or so as we do our webcast. Let's go over here. This is Sulema Salgado. A lot of people know you. You are a familiar face around NPHIC.
Absolutely. I'm excited to be here and honored. It's been so much fun so far on day one. This is day two. We've learned a lot. There's a lot of things going on, and it's good to see my fellow colleagues that I don't ever really get to see except at conference.
All right. Now, you're the telehealth director with Georgia Department of Public Health. So right here, your hometown.
Right here in my hometown. I previously was the Deputy Director of Communications and have now taken over telehealth and telemedicine for the state of Georgia, and we're hoping to increase access to care. Okay. I want to find out more about that as we go on. Now, we've also got with us Brian Williams. Now, Brian, normally you'd be on NBC Nightly News, I think. But apparently you are not that Brian Williams. You're a program development specialist, right?
Yes, with the Fulton County Department of Behavioral Health and Developmental Disabilities.
Okay, so that keeps you a little bit busy. And that is a long title. Does that even fit on your business card?
It does fit under the business card, and it does keep me busy, but it's wonderful work where we're trying to educate the public about both behavioral health resources available to them here in Fulton County, and also public health resources too, and the wonderful services we offer.
Great. All right, now we've also got another panelist here with us, Porfirio Villarreal. I'm so bad at that, but pronounce it correctly for us and tell us who you're with.
Yeah, I'm Porfirio Villarreal. I'm with the Houston Department of Health and Human Services. I'm a public information officer.
Okay, is this your first time at this conference? Have you been here before?
No, this is my first conference, and it's great. I've learned a lot, and I'm looking forward to attending many because it is a very good conference.
Okay, that sounds good. It's been kind of exciting. Have you guys been able to get out to the main sessions here? There's so many choices, it seems, on the breakouts.
It seems like there's a variety of sessions. I think the social media ones have really been drawing a lot of attention. I know it's the new trending way. I did listen to one of them and thought it was fantastic, but most of our time, Brian and I, we've been spending it at the booth trying to encourage people to join NPHIC, become members, and kind of just get them to understand what we're doing here at this conference.
Oh yeah, you guys have been ruthless. I watched Brian a few moments ago. He was reeling them in.
Oh yeah, any second he gets, he's over there just attacking people, so it's awesome.
Well, you know, the work that NPHIC does is wonderful. And this is the only conference of its type where you learn the type of information that really pertains to what we do, and especially trying to do the outreach we do to the public health community. And so I'm passionate about NPHIC.
Well, no kidding. It definitely comes through. You are very passionate about NPHIC. So the conference here, this is interesting because I think there's some people that think this is NPHIC's annual symposium or not, but it's not. This is really kind of a different approach this year. As a matter of fact, NPHIC President Robert Jennings had a chance to talk with him earlier, and he said that NPHIC took on a really big role at this year's conference here in Atlanta.
At the national conference, we've always been a partner, but this is the first year that NPHIC has had to step up and actually sponsor the conference. CDC is just supporting us, so this is an actual NPHIC-sponsored conference, and I believe is the first of its kind. This is a big challenge to do a conference like this, and the other part of that is NPHIC has its own symposium coming up in Chicago next month. So not only did we have to put on this national conference, bringing folks from all over the country to Atlanta, Now we're going to have to turn around and do the same thing and bring people from all over the country. Register today. If you've been following us on Twitter, if you've been following this national conference on public health communication, you know that there is a lot of good information out there that you can just missing out on if you don't take advantage of. And so go to your fiscal folks and say, hey, I need the money to get to Chicago for the NPHIC 2013 symposium.
All right, so the symposium is coming up. It's going to be a lot of fun and a lot of learning, a lot of training. It's actually in Chicago this year, which is a little bit different location. At least I haven't been to Chicago in quite a while.
I haven't either. I've gone to San Diego, I've been to DC, but Chicago seems exciting, and I think it's the perfect time of year.
All right, so what are the tricks? I know some folks may not have the opportunity, to go to the conference. They've got to go convince their fiscal people and their health directors and all. Do you guys have any experience on inside tips on how to get to the conference?
I'll give my personal one that I know seems to be like the seller that I've done a good job at, I guess I feel, pitching, has been really focusing on the fact that this is one of a kind. It's the only public health communications conference of the kind specifically geared towards the day and what we do day to day. There's a lot of other conferences that have public health tracks that are specific to health departments and state and local health departments, but this one is all around public health communications.
Okay, that's a good one. Anybody else?
Sure. The way I'm going to the conference is because NPHIC called and asked me to present a webinar on helping the Latin American consulates on how to participate or get health departments to participate in Binational Health Week.
That is great content.
So I did the webinar, and I guess it's a reward for helping out. I got invited, and so I got a scholarship to attend the seminar.
Okay, so you got a little bit of a reward there, but really the motivation for a lot of people, I think, would be to come and get this information, because having great info on how to effectively outreach to all of the different communities we're trying to reach is something that's it's not easy to get, and NPHIC has got it. So
absolutely. I thought Salima summed it up. I couldn't say it any better than she did.
It's like a one-stop shop.
Yeah, exactly. All right, so if you have not yet registered for the NPHIC Symposium in Chicago, go ahead and register for it. It's on the website at nphic.org. You're going to be able to get in there and just have a great time and learn a lot, because it's going to be you and your public health colleagues. Now, we are, though, in Atlanta right now at the National Conference for Health, Communications, Marketing, and Media. I can't believe I can say
that.
You did it. No script on that. But we are here, and the conference kicked off. We had some great keynote speakers, including keynote speaker yesterday was Katie Payne, and she is a CEO and senior consultant with Payne Publishing. She talked about how you quantify social media, and also the way that the media has changed dramatically.
Media is now everywhere. It is on your phones, it is on your car, it is on the plane, it is everywhere. People are getting their news from everywhere. There is an intolerance for messages. Unfortunately, you guys have been so good all these years at getting those messages out there, nobody's hearing any of them, because they're seeing 6,000 messages a day, and who can make sense out of any of them? So it really comes down to, as much as it may be part of this title of this conference, it's not about the media anymore. What it is it's about your business, your mission, your customers, the people that you serve. Because one of the scary facts out there is that viewers are now more likely to stop watching commercials on television the moment a brand comes out, the moment a message comes out, people turn off. So a lot of what you're going to hear over the next few days is going to be about how to adapt to the fact that the old ways don't work anymore. Why don't they work? They don't work because the basic structure of social communications and interactions is falling apart. It's not about how loud you shout. For years and years and years, we all just thought, well, if we could just shout a little bit louder, a little bit better, people would finally get our messages. It's not about that anymore. It's much more about targeting, about measuring and testing, and doing a whole bunch of iterations very, very fast to figure out what really works.
Some interesting information there about media and how things have really changed. So I guess my question to all you guys is, what has changed for you? Everybody here has been at their jobs for a while, and we've seen changes in media. We've seen social media come along. What kind of changes have you seen? How about over in the Houston area?
Well, everybody's into social media now, so you've got to just continue your efforts to try to reach more people and get the message out and know about the benefits of your department or your program or specific issue or initiative that you want to do. So just making sure that you continually educate about health.
Now, was that tough for you getting social media into your department or expanding? Have you had some hurdles?
Well, it's been a hurdle because being a very small department, a department of two, for 60 different programs, it's tough because you've got a lot of issues that you have to tackle plus social media. But what has helped me is that I just recently got an intern, and they're tremendous help. So you can never underestimate the power of youth. And so they come in, you basically orient them, and then they go on their own and they help you create content. And it's great because they get a benefit of the experience. They learn about public health, and then you benefit because it's one less thing you have to do or just supervise, and that's great.
Yeah, good thing. How about you, Brian?
Well, he's right. Social media, and not only that, videos too, and videos that we're creating ourselves here in Atlanta at Fulton County Government. I remember a time 10 years ago or more, everything was brochures and flyers and posters. Nobody even talks about that anymore. So we are doing video and video production, short, effective videos, and we're posting them on the website. And
you're doing them yourself.
And
right?
we're doing them ourselves, and we're speaking in a language that people can understand with very effective points, and we're tagging it to different areas of our website, and we're even archiving them so people can look at past things. All of our campaigns are moving to videos. So he's right, social media, videos, using technology, that's the way it's going.
Good for you guys. And have you been able to be timely with things? Have you had any, not everybody's had an experience where, hey, we need to get some information out super fast. Have you tried any really fast turnaround videos yet?
Well, we're doing one right now where we just September starts National Recovery Month for people with substance abuse and issues and substance abuse, / mental health issues. So we just started producing the videos last week, and we're shooting another one tomorrow, and it will air next week.
Okay.
And it will be online. So yeah, we can turn it around pretty fast.
Oh, great.
Some of our local districts are doing very similar stuff, but they're doing it during crisis communications, during tornadoes, when there's warnings and telling people where to go.
Right.
Some of our local districts pretty much get their eye cameras, they flip whatever they have available, turn around, their public information officer is telling people where to go, what to do, posting it on their YouTube and connecting it on their Facebook and Twitter, and people know exactly what to do. It's kind of like their first way of getting information before the news even reports it.
Yeah.
So they're really loving it.
That's great to be able to have that kind of flexibility and be able to quickly get information out, because video is so huge on the web. It's, we all know that if you've got clickable content, you can put more information out there and have people actually engage with it. If you've got something other than just see our news release on the website.
Right.
Correct. Gone are those days.
I know.
Another thing we're kind of working on that we think is pretty cool and being innovative is a lot of local apps. We're actually working on an obesity app right now where we're working with Georgia Tech, and our governor's office has endorsed it. The governor's put out a call to action to all these Georgia Tech students saying there's going to be a $1,000 prize for who comes up with the best obesity app. So we're doing a challenge like that just to kind of engage people, help them maybe do some geolocating and find fitness centers and local places where they can go in their community. So maybe with the geolocation feature saying, I'm located here, what's around me, what can I do on the weekends, what resources are available.
Yeah.
So we're doing those kind of innovative things.
So it seems like with apps, that's the way things are going. People don't really want to go to a website. Have you guys found that at all? Or, I mean, you still have your websites going, but it seems like apps are really, really becoming more important.
Apps are really becoming more important, but I think too, like what we've done in Fulton County government, we've used our website as a marketing tool. So we know it's very difficult for someone to go to www.fultoncountyga.gov / this, that, and the other. So our web address is www.livebetterfulton.org. Now that's for the health division.
Yeah.
Just for the health services. So we can market livebetterfulton.org and get you directly to the content we want you to see.
That's a great idea, Brian. Well, meantime, if you are just tuning in to our NPHIC Live webcast, We are in Atlanta, Georgia at the National Conference for Communication, Marketing, and Media. You know, this conference is all about effective communication, and there is so much great information sharing going on. CDC's Associate Director for Communication from the Office of the Director, Dr. Catherine Lyon-Daniel, stopped by a little while ago to talk about the conference. The theme for this event is Waves of Change, managing the possibilities.
Oh, there are lots of waves of change right now. The field of public health is changing, the field of healthcare is changing, but more importantly, the field of communication is changing. At CDC, our scientists are working 24/7 around the world to save lives and protect people. And that's addressing threats to health security and the leading causes of death. And as communicators, we have to help our scientists do that work and get people the information they need. So we also have to be present 24/7, either in reality or virtually, because people need information when they need it. My appreciation to NPHIC for holding this conference, because as federal employees and as state employees, even local employees, we all know that budgets are short. Often, you know, the science comes first. Our information has to be accurate and reliable, and so communication is often the hardest to accomplish. So whatever we can do and the latest techniques that we can use to amplify our messages is even more important. At CDC, innovation is really key, whether it's nanotechnology or bioinformatics or the latest in molecular detection. Our science is at the cutting edge, and we think our communication has to be at the cutting edge as well. So what works? Finding out how to do it and being there. Being on the cutting edge of government isn't always exactly the complete cutting edge, but if we find out what works and where people are and what they need, then I think we have a responsibility to do that. Ultimately, yes, we're moving faster than ever, and data and information have to get out there. But we're really talking about making human connections. So the way to take what used to be a long piece or a one-pager, shortening that to a Facebook post, and then to a tweet, and then to a 6-second video, we have to learn how to tell the compelling stories that inspire action in ever shorter and faster ways. So when we learn what we learn, we pass it on to state and locals, and it's two-way engagement. So we learn from state and locals, bring it back to CDC. It's a great partnership. One of the things we've prioritized this year in my Office of Communication is creating templates and tools that states and locals can use, because why have 50 sets of people creating the same types of things? So we've created, it's on a website, I can get that for you, with downloadable templates so that you can just go in there, pick what you need, customize it and tailor it to what you want, and then give us feedback and tell us, how did that work? Can we change it? Can we make it better so that you can use it? Well, I know there are a lot of people watching this who couldn't come to this conference, and travel and training are one of the things that are harder to get. And I do want to learn more about how we can connect either online or through other venues so that we can all keep learning. Coming to events like this is great, but for the 200 people who wanted to come from CDC, only 50 of them could come, and many others who would have liked to have come. So I would like to continue learning from each other and sharing lessons from each other, because we all have a lot to learn.
All right, that was Catherine Lyon-Daniel from CDC, and it's been great to talk with her, and she is going through the exhibit hall and through all the sessions and talking with everybody, and it's great to have that kind of access. I think that's one of the key things about being able to come to a conference is you really do, you are able to hang out with some very high-level folks and get some great information right from the source. Now, we know that not everybody has been able to come to the conference here, and some of the folks watching right now are sending us questions, which we appreciate very much. And one of them that just came in, you know, we were just talking about social media a moment ago, is how do you handle photo and videotaping or photographing events for posting on Facebook and other social media sites? Now this can be an area of controversy for some folks, because, right, a lot of folks handle it different.
How we've been doing it here in Georgia as a state perspective is, if it's a public event, if it's a community event and you're going out into the public and we just want to snap pictures showing that our staff was there attending and interacting, then we just snap the pictures and use them on Facebook. You're at an open public event, open and accessible to anybody.
And that's similar to how the news media works,
exactly,
right?
just like news. But if it's a private event, it's public health funded, we hosted it, we're encouraging people to come to us, then, you know, we'll have, when people sign in, a little disclaimer at the bottom saying you may be photographed. If you're not interested, please let us know.
Yeah.
What about
have you guys run into that issue yet? Or I mean, some people just ignore the issue.
What I do is just always have them sign a consent form. If it's gonna be one-on-one. You've covered public events, but if I'm gonna post something, use that photograph later on Twitter or any social media, I just ask for a consent form. And also, sometimes it's just saying we're gonna videotape here, we're gonna take photos here, and people get out of the way. Most of the time, it's no problem.
Okay.
Same.
Yeah, same thing.
Exact
Ditto.
Same. Ditto.
Okay. Well, let's see. I got another question too, and actually I should have pre-read the question, but I didn't. Any of your agencies have a social media policy for employees? Now, we've all seen examples on the internet where an employee has gone rogue and ended up getting fired, over their personal views, which is kind of an interesting thing policy-wise, even though they're posting on their own Facebook page. But the person is asking if anybody has a social media policy for employees, including anything that they might post on their own web page. I just saw a police dispatcher fired for discussing an incident on her Facebook. Well, that sounds like a privacy issue, though.
Yeah. We personally do not. Opens up Pandora's box to a lot of other stuff when it's a formal written policy. So we've been advised to kind of just, verbally say what we'd like to see you guys do and what you don't, and let each division and program kind of handle that on a case by case. What about you guys?
We do have a social media policy, and that comes from the city, so from the mayor's office. And basically, it covers mostly how not to set up social media sites on behalf of the department. Everything, since I'm the administrator, then if you are setting up any type of site, then I would be made an administrator, just to make sure that, if you're going to set up your page for your program, your HIV, your WIC, or your lead program, you've got to let your public information office or your public affairs office that you're setting one up, you want to do this, so that's how we do it. I've got to be made an administrator in case somebody goes rogue, that's what it covers.
And you know what, that also makes sense from a standpoint of if there's somebody in another department who leaves and with them goes the password to that Facebook page. And I know that happened at my previous county government level employer. It can cause quite an issue.
So here's the question, and kind of just go into that. We kind of have the same thing. Well, it's not a formal policy, that's kind of the procedures that we follow, but do you have separate pages for each of your programs, or does your agency just have one page that covers all topics? For example, a Facebook page just for the Department of Public Health, and you can put HIV, STD, immunizations, or does each program have a separate page? Because we face that all the time with people wanting to have their own page, and we're currently not doing that.
Well, we have our page for the department. HIV has its own page, and they administer it. I'm also an administrator there just to make sure if something does happen, I can go in and change or pull it or what have you. But we've found that a lot of people have come to me and said, okay, I'm going to start one. So what I do, I say, okay, start with on our website, on the Department of Health and Human Services website. Once you make sure that you've got a month worth of things you're able to post, that you've demonstrated that you are going to continue, that you're just not going to die there. And a lot of people, nobody has taken me up on it because it is a lot of work.
Yeah.
And so people have limited resources. So really nobody's come through. HIV has their own, but they have enough resources and to do that. And they're the ones that have been doing it.
Yeah, good question. I know in Sacramento, we definitely try to limit the number of separate pages out there because certainly in public health, every program wants to have their own thing, do their own thing. It can be kind of a nightmare coordinating all of that. So definite challenge there. All right, so we are, believe it or not, we are like halfway through our live webcast, and we have so much more to get to coming up. We're going to have Laura Taylor and Tom Slater talking about some great media policies and how you can prepare yourself for an interview. We've got social media with Valerie Daniel coming up. And we're also going to tell you about a new program that's pretty exciting. We're excited about some of the partnerships that are happening here at NPHIC. So thanks for tuning in to our live webcast. We are from the National Conference for Health Communication, Marketing, and Media. We are here in the Exhibit Center live right now in the Hyatt Hotel, Hyatt Regency in downtown Atlanta. And Joe Rebele from NPHIC, he is making sure that this stays on the air somehow. He's personally seeing that the internet is at highest speed possible. In the meantime, who else is in charge? It's Robert Jennings. He's NPHIC's president, and he says that, hey, NPHIC is doing great. Membership is growing. We always like to hear that because certainly that is a healthy sign.
Yeah, we're over 500 members now, so I think the state of NPHIC is good, and it's great actually. And I didn't mention, but one of the things that I'm most proud of during my tenure is that we've also increased our tribal outreach. So we actually have 20 new tribal members as part of NPHIC. So this outreach is growing. Folks are seeing the value of NPHIC. I'm excited about the things we're doing on our website. We just started a Twitter page, and we have over 800 followers now. It's been exciting. It's been a great year. The staff at NPHIC have been working hard, filling some of the requirements out from our cooperative agreement with CDC. A lot of our activities are developing toolkits. We established a thought leader group that we share knowledge with our thought leaders, and then we discuss best practices. There are folks from academia, from healthcare, from public health, and they're all very high-level folks within their communicators within their field, and they're not necessarily communicators. They may have a special discipline, but they bring something important to the field of communication. They have been a great help to us so far. In fact, in our credentialing program, they are the ones who helped establish the Public Health Communicators mission statement. So we've got a mission statement, it's been adopted by CDC, and we can thank our thought leaders and other national experts for helping us with that. One of the things that is important for NPHIC going forward is to develop strong partnerships, and we're really looking at developing partnerships with other like groups, with other people within the public health field at the local, state levels, private organizations. We really think that partnership is going to be the key to all of us being successful in our mission to improve the lives of people. So it's been my priority to develop strong partnerships within NPHIC. We're moving forward on NPHIC credentialing. As you know, the credentialing is to standardize what public health communicators would know and do. And I think our field really needs a standardization and set of standards for our communicators. We're moving along nicely, but in any credentialing program, there's protocols that you have to go through, and we have to make sure that we check all the boxes in our credentialing process to make sure that we do it the right way. But I'm pleased and excited about where we are right now, and public health communicators can look forward to having that credential next to their names soon. The challenges that we'll have over the next year is keeping up with all the changes within the organization, what the expectations of NPHIC are, and just the changing in public health, and the various laws and rules and regulations that are happening that are just impacting the way communicators are doing their jobs. And so we've got our challenge ahead, that's for sure.
All right, that's NPHIC President Robert Jennings, and exciting things are happening here at the NPHIC conference and at the booth. Let's go over right now, just take a peek at over at the booth, right adjacent to our little broadcast area here. That's where Sulema's been hanging out, Brian has been there, we've had Laura Espino, had Chris Smith, and they've been over there talking to folks. And what have you been hearing from people? People seem to be excited about NPHIC when they hear about it.
I think people are super excited. First of all, the first thing they come in is and say either they've heard a lot about us or they're excited that we're hosting this conference. So they're like, all right,
nice.
We know a little bit, but not enough. But my biggest sale pitch has been, mentioning our speakers bureau at the upcoming symposium. We're working on a Train the Trainer course, which is going to allow us to help recruit additional, not only NPHIC members, but also recruit communicators and students to become public health communicators. And we know that a lot of students and people that have come into this position and working in public health have kind of either just fallen into public health.
Right.
But what we're doing is we've come up with a comprehensive PowerPoint and a training, like a presentation that people can go out, NPHIC members can dedicate and say, okay, every year I'll give 2 presentations. Here's a canned presentation with the benefits of being a NPHIC member, full of PowerPoint slides, testimonials from NPHIC members sharing their experiences on anything from salary, the benefits, a typical day in the life of a public health communicator, why they chose the career, why they didn't choose the career, but they love being in it. So it's really kind of like a bio, but built into a PowerPoint. It's kind of like our sales pitch as to why public health communications is the way to go. People seem really excited about it.
See, that's great to have that kind of a tool. I know it took a lot to put it together, but there's people on there from public health agencies all across the fruited plain. Right?
Yep, we've got people from California to Texas to New Mexico to Georgia, Australia. I mean, everybody. So what we did is we also made sure that the presentation had all walks of life, everybody from college freshmen, people that just are, student members, people who are new to NPHIC, and people who've been seasoned in NPHIC and public health communication. So you'll hear everybody's experience.
So as one of our newest members here of the on-air panel, so when you get back to Houston, that's your task, is to get a whole bunch of people involved in NPHIC.
Check.
Yay! We've recruited one already. My job is done.
And what else is going on, Brian?
Well, to pick up what Salima said, we do have people not only from all over the country, but all over the world. We had a gentleman from Nairobi, Kenya, that gave a fantastic presentation about messaging that they were doing to reach hard-to-reach populations. And that's a big thing, Kerry. People are really talking about apps and technology and millennials, the new generation here, how to reach millennials. It's all technology, and we're all learning from each other what other people are doing. And it's exciting, it really is exciting. And everybody I've talked to said they're really excited because there's nowhere else that they can go and get this type of information on using technology to reach the audience that they're trying to reach from the public health aspect. So.
And I've noticed it has really cranked up in the last few years. It used to be social media and the technology
social
part
media,
was a very small part of the overall conference, and now it's like, it's huge.
Yeah.
It's amazing.
That's what it is. That's what it is. Technology, social media, video. Yeah. I mean, it's like, you remember, Salima wouldn't remember, and Porforio probably would remember. But, some of us remember the typewriter.
Yeah.
Then there was a day, it's history. It was the same thing here with technology.
Yeah.
Yeah,
you're dating yourself. I can't personally remember a typewriter. I'm not sure what I've heard about them. I've seen them in the movies. I have no idea what they are.
I think another big thing and selling point that people keep wanting to come to our NPHIC booth about and learning about specifically is our credentialing program. And I know Robert mentioned it earlier. It's pretty much it's really a big deal. It's kind of in its infancy. We're still kind of piloting it right now and doing some beta testing. But I think it's going to be huge. I know a lot of public health communicators are always like, there's the APR and the CPRC, and then there's the CHES. Yeah. There's all these different credentialing that public relation people can have, but there's not one specifically geared towards public health communicators.
I want something after my name, darn it.
Well, there you go. This is something we're actually working on right now. Is coming up with a public health specific credentialing system, and we're looking at it right now to see if it needs to be a test, if it needs to be a portfolio, because really a lot of what we do is day-to-day practice, implementation. Right. What can we show? How can we show the knowledge and the experience we have? And that's something that we're looking to roll out in the fall, so be on the lookout for more information about that.
Ooh, that is exciting. That's very good. And I bet you'll be able to get more information when you come next month to Chicago to the training symposium.
Absolutely.
Not too late to go on the website and sign up for that right now. NPHIC.org, NPHIC.org. Go and sign up. All right, before we move on here, we've got a couple of follow-up questions here. This is great to hear from all of you who are watching right now. We've heard from Iowa. Is that this one? No, that was a previous one. Let me just read the question. In regards to the question asked about social media policies, yes, this is from Iowa. Hello and thank you. We require anybody who uses Facebook while at work to create a Facebook profile only for work use. That's interesting. I need to know a little more about that, because what do you put on that versus...
Yeah, how do you have one for work use versus personal use? So maybe I have an idea for that. A couple people have asked us that. Like our injury prevention coordinators in our office they do a lot of grassroots events. They do out car seat safety. They want to friend a lot of people that they know, partners in community organizations. But for example, like me, I would love to Facebook friend you. Whether, depending on how our friendship relationship is, I may or may not want to looking at my personal page, but I may want to create a work Facebook profile where I can network with other work professionals and share what I'm doing. So maybe that's what they're talking about, creating a Facebook page.
Because we don't want to know all the crazy things.
Yeah, you don't want to see how I celebrated my birthday, tonight, but we just met at conference today, so I'd really want to friend you so I can have access to your resources. So maybe
and
I
happy
have to bring
birthday
the
to Selena today too.
It
She's
is.
here on
It
her
is.
birthday.
Well, that's great.
Working the NPHIC booth.
And you know
Happy
what?
birthday.
Who else has a birthday today? It's Tom Slater. And Tom is with New Jersey Department of Health. And as a matter of fact, guess what? Tom is coming up here because we do have so many talented people who are on a part of NPHIC who are involved, and Tom has been on the board and everything else. He's very active. He's been here at the booth. So we got the dynamic duo of Tom Slater and Laura Taylor
this should be good.
here, fresh from the media training session that they have conducted at the conference. And we asked them, hey, bring us some of your best tips. We want to hear some of your best media preparation tips. So the next time you find yourself in the camera, you're in front of the camera for an interview, you're feeling a little bit more comfortable. So Tom, what are some of the ways that a communicator can get ready to go on the air?
People can prepare for media interviews in a number of ways. The most important thing they need to do is anticipate the questions that will be asked. And you can anticipate just about every question that will be asked for a certain subject matter. And then the second part is to prepare the answers to those questions. And the third part, and we can't stress how important this is to practice those answers at least once, preferably twice, before actually doing a media interview.
So some other tips and strategies that we teach participants in the class are, one, keep your messages simple, right? So we tell them to speak in simple, clear, concise words in clear language. I know everybody is educated and we want to speak highly, but we need to make the message so simple that everyone, the masses, can understand. We also don't want to use jargon or technical terms or acronyms that our public may not understand. So we need to have participants recognize that while they're using the media as a way to get the message out, the message is ultimately for the public. So you need to speak in language and in terms that the public understands, which is for a lot of us very difficult because we speak in technical terms every day and we use acronyms every day and they just kind of roll off our tongue very easily. So it really is important, as Tom said, to anticipate, practice, and prepare those messages so they're simple and clear and concise.
One of the key components to preparing is to put messages into what we call a bucket list. One of 3 buckets. First bucket is what you will answer. Those are your key messages, what you want to answer. The second one is questions you'll answer only if asked. You know they're going to come up, but they're not your key messages, but you need to be ready to address them as well. And the third bucket is things you won't answer. And those are things typically like confidential information about patients, residents, also litigation that's ongoing. You really can't talk about that. And the key to getting to those points, their key messages, is something we call bridging statements or transition statements. And those are statements that the most important thing we're talking about today, or what people really need to remember, or our main focus is. And those will bridge you back to your key messages when you're asked a question that's not part of your key message. And another key to those, to put it all together, is called a blocking statement. That's a very good question, but today we're talking about the most important things people can do to protect themselves. Let me tell you about them. So, and these are not things that are easy to do. They must, again, be practiced.
And that kind of leads us into another concept that we use called the rule of 3. During times of crisis and stress, people really can only wrap their minds around 3 things. So we need to figure out what the 3 most important messages are that people need to know. And again, that's very counterintuitive for us as health professionals because we want to empower people and give them all the information they need to make good healthcare decisions. But again, this is not business as usual, it's stress. So during times of stress, we really need to limit what we say to 3 key messages. And that kind of goes back to what Tom just said with the buckets, right? So we have what we will talk about, what we'll talk about if asked, we won't talk about. What we will talk about are those 3 key messages that Tom made reference to.
Another really important aspect is to tape yourself on camera. There's many ways you could do this. One is to have a regular video camera like you might have at home, or most cell phones now, smartphones, have video camera components to them. Or if you don't have that, practice in the mirror. The important thing is to practice your nonverbal skills. There's a lot of nonverbal parts of responding. How you react, how you say things, where you hold your hands, whether they're up, whether they're down, like that. Okay, and you need to practice because a lot of times you don't realize what you're doing and that you're doing them while you're being interviewed.
The face is the most expressive body part, and especially depending on where you're from, you might be a hand talker, and that's fine to make hand gestures, but we always tell people practice either in a camera or in front of a mirror, so you know what kind of nonverbal communications you make, so you know if it's distracting or if it helps the message get across.
We're taught a lot of things, that this is self-defensive, very defensive pose. We're taught that this is too nonchalant, as is the hands in the pocket. This never looks good. So we always tell, just keep your hands straight at your side, or this is fine.
A lot of nonverbal communication is very unconscious, and you don't realize if you do raised brows, side eyes, look up, until you actually see yourself on camera, which is best, or in the mirror. You can even see how you respond to different questions based on your nonverbal communication. And you know, what you don't say is just as important as what you do say. So keep the nonverbal communication to a minimum as not to distract from your message.
We advise everyone to practice in their office with their colleagues, with their coworkers, to form a media team so they can practice developing messages, delivering messages, and practice being a reporter, practice being the interviewee. That is the only way you get better. We like to say media's training is not a driver's license where you get it once and you have it for life.
And we all know how that is.
Instead, you need to keep practicing, you need to keep better. It's a skill that needs to be honed. Another challenge is dealing with difficult reporters. That often happens during public health emergencies when reporters are looking for different angles and there's not a lot of information, so they're searching for different story angles. What you can use to respond to those reporters are the bridging statements, the blocking techniques, and sticking to your key messages. What we like to tell people is that responding to the media is a little bit of a game. We have key messages we want to get out. They want to get a good story. By being prepared, having clear, concise, simple messages, and actually information that will help the general public, you create a win-win situation.
Great job, Tom Slater and Laura Taylor. What a hilarious duo they are.
They're fantastic.
Oh my
Everybody
gosh.
loves them. You know when they've walked into a room. It must be that New Jersey thing.
It's a New Jersey. It's a New Jersey thing. Yeah, exactly. I heard a lot of New Jersey stories last night. Let me tell you, that's one of the great things about coming to a conference, whether it's this one or the NPHIC Symposium, is hanging out with your colleagues and getting time to network and really increase your knowledge and just get to make some friends and colleagues that you can call on when you need them, because we all need to reach out to folks.
Yeah, and we really all become a huge family. I mean, when we see each other now, we're like super excited to hang out and catch up, and we ask people about their kids and their pets and what's new, and we really become such a really tight-knit. There's so many of us, but we all seem to connect and gel very well.
Yes. In fact, we need to get a NPHIC hotel for the next conference that allows pets, so we could just bring your pets to the session.
I'll leave mine home.
How about that?
Mine are
No, I want to bring mine everywhere. Pet friendly, that's next on the list.
All right, so we were talking about social media a few moments ago, and a couple of things come in, and thank you very much for those of you who are chatting into the chat room. Our IT guy for NPHIC, Joe Rebele, is over there finding out all of the comments and running them over to us here. But the CDC, this is a comment from somebody, kind of a question. The CDC offers web badges. And badges are those things that you place on your website that may link to real-time content, such as how many flu cases do we have nationwide, or links back with an image though. But apparently this person's IT department will not allow them to place these badges on their website because of, what's the reason we always hear? Security concerns. Okay, so anybody else experience security concerns with this kind of third-party content?
I haven't so much, but I mean, what better place to actually get real information and the most safe information than CDC? I mean, really, and just coming to NPHIC conference alone, there's tons of CDC's IT people here. The content syndication team is here, and they're fantastic. I think they'll be able to kind of connect with each other. If you're here, see them, stop them, and ask them. Get a business card and have your IT people talk to them, because I mean, I don't see a problem with it. We use their syndication stuff on quite a few things like flu and when we have meningitis outbreaks and that sort of stuff, and we think it's fantastic, and it's a lot easier for us. We're not getting as much even media calls just by using those badges. So I would encourage them to come to conference, or find a NPHIC member who has a CDC contact, and they pick up the phone and are always available.
Yeah, this is really where you you draw upon those contacts. I know when I was at Sacramento County Public Health, I would talk to the social media experts here at CDC, and you can certainly, I'm sure, put your IT person in touch with their IT person. They've been nothing but helpful when I've called. And believe me, at least from my experience and what I've heard, nobody is more concerned about security than CDC with critical health information and all of the very high-level programs and things they work on. So
I agree.
I think it's a safe bet.
Just a quick phone call to probably fix that.
Yeah. Let's see. We got another one. Not sure what this is referring back to. That's exactly what we do. The department logo is used as the picture. They are prohibited from providing personal information. Does that ring a bell? Were we talking about that earlier?
Probably for Facebook pages.
Facebook pages, yeah. So anyway, and then one more here. I know that one health department, probably their own, that worries about Facebook because of how much work it may add for a way to complain. Oh, I see. So in other words, if people are complaining on Facebook, if they're putting comments in there, that it's going to add a lot of work. The example would be the restaurant inspection, and they fear people blasting restaurants and such on their Facebook page. So what about that? Because social media is all about connecting with people in two-way communications, right? And I know there's some agencies that, for whatever reason, they'll turn off the ability to interact, which totally defeats the purpose.
Absolutely. We actually allow it. We encourage it. If there's something in there and we notice that it's being miscommunicated, that's why we're there. We step in, we give correct information, we say we understand your concern, here's the facts, here's some history behind it. So I guess that's a perfect time for us to engage and show them that we're really active. But we don't turn anybody off unless they've gotten to the point where they're just constantly becoming an issue. We'll send them a private message and try to address it behind the scenes. And then if not, we'll finally take it to that level and not allow them to post, but we've never not allowed it to be an interactive platform.
Have you had issues in Houston where you've gotten negative comments or things you need to respond to that you would have preferred not be on social media?
Well, not really negative, but I think there are great opportunities to educate people because if, for example, somebody is complaining about long lines at one of your centers or delays in getting something from the department, well, that's another way you can educate not only that person that is complaining, but also other people who may have seen that posting and tell them, okay, this is how the process works, or this is how you get into WIC, or whatever. It's a chance for education.
Right. And that's really good information. So there's a lot of techniques too. There's a lot of good information out there about how you can, combat, how you handle negativity on your website. There might be something, put together a little training on something at a conference, specifically, handling negative comments and such, because I know that's always an issue for a lot of folks. So I think that runs through pretty much our questions. But, in the whole social media area, Valerie Daniel is a social media expert. We had a chance to talk with Valerie. She was on last year's webcast, if you happen to watch that. She works with the CDC, and we checked in with her about some of the latest developments in social media that we might want to know about or keep an eye on. Right now we're talking with Valerie Daniel, and you're an employee of Northrop Grumman Corporation, but what's your role at CDC?
Well, I'm lucky. I love my job. I work on the social media team with very talented, all women for some reason. We try to get guys in there, but women are the health communicators. I get to work on health communication campaigns, if it's around a health observance or other initiatives. I also am a social media coordinator for Vital Signs, which is coordinates with the MMWR. It releases on the first Tuesday of the month, and it addresses a vital health issue and has a call to action to different audiences.
How has social media been a part of the Vital Signs outreach?
I would say it's been a huge part. We want to be where our audiences are. We want them where they're already talking, so that's why we got on Twitter. We just did our first Vine video about prescription drug overdoses for the last Vital Signs, and that performed really well.
Now that's interesting. It is tough to try and figure out, how do you pack something into 6 seconds? How did you do it?
Oh gosh, we used a data point that the program came up with about showing the skyrocketing rates of overdoses in women, and then we had a rocket on a graph, and it's only 6 seconds, and then we had the link to the Vital Signs issue for more information.
And kind of the trick with something like Vine is you've got to do it all pretty much real time or do it all at once, right? You can't really edit and upload.
Right, you need to have a smartphone, and you can do the stop motion video if you want to do that. Our graphics department actually came up with the graphic, and so we filmed the computer screen, so we cheated a little bit, but it was really well received.
Out of curiosity, have you experimented with Instagram video yet?
Yes, we're very excited. We just got the terms of service approved for CDC to use Instagram, so we're working on launching that channel. We're hopefully going to do that in September, and we have a lot of neat ideas. One of our ideas is Spot CDC with the hashtag, so that's if you're traveling in the airport or on MARTA or you're reading a magazine and you see a CDC statistic or graphic, you can take a picture of it and upload it and tag Spot CDC.
Now that is a cool idea because it gives feedback as to what people are actually seeing out there.
Right.
But also engagement.
That's what we want to do, and then we want to use it with different health communication campaigns as well. We're about to use it with the CDC Museum and show CDC history. I know it's about to be National Museum Day, and so we want to promote people going to the CDC Museum and learning more about the history of CDC, and so that should be neat.
So what have you observed? What is going on in social media now? We've heard things about, kids are abandoning Facebook and they're going to other platforms. I'm just wondering what you could share with our communicator audience that you've been discovering over the last few months.
I think you're very smart to ask me about Instagram. As usual in social media, visuals are working great. Pinterest is huge with the female audience. There has been a little bit of Facebook fatigue is what they call it. The younger audiences are using Twitter more. There's a Snapchat app. I haven't really looked into it, which teens really like to use. So it's constantly changing. You basically have to figure out where your audience, what resources do you have, and which channels does it make the most sense to put your health messages on.
Now I know you've been doing social media sessions at these conferences. What have you seen in the last few years as far as really the level of expertise of public health communicators maybe getting their toes wet in this area?
Oh gosh, my best advice is to just read, try to stay up on the research. The sessions have been great. I just went to a great session about social media evaluation, and really it's key communication 101. You need to start with your goals, your strategies for social media, figure out where your audience is, and again, look at your resources and figure out where will you get the biggest bang for your buck and reach your audiences.
Yeah, I know at the general session, the kickoff session yesterday, Katie Payne was really talking about you can quantify this stuff, but it's a little mysterious for some folks, I think, to try and figure out how do we quantify what the impact is.
Right. Katie did a great job. I think with leadership, you always have to show big numbers like reach, and reach isn't really a concrete number because it's a potential reach. Not everybody might be reading your tweets. So I think she made some great points about how relationship development is really important. Try to figure out who your brand advocates are, your influencers, by seeing who's really active in social media and who's talking and who people are listening to get them to change their behavior or opinions. And reach out to them and just nurture those relationships.
Do you have any advice for those who are still having maybe some trouble with the IT department, or management doesn't quite yet get that this is important and they need to be doing it?
I guess my best advice is the conversation is going to continue whether you're in that space or not. And it's better to be present in the conversation and try to correct or redirect the wrong messaging that might be out there, as well as encourage the right messages that are out there and the creative ways people are spreading your health messages.
great. Well, Valerie, it's been great talking with you. How do people connect with Vital Signs?
You can go to www.cdc.gov/vital signs. Typically, we launch the first Tuesday of the month. We just had one launch on childhood obesity. So stay tuned. We have some great health topics coming out, and we're always trying to stay on the cutting edge in social media.
All right, thank you, Valerie. Great job, and good information and good tips, and staying on the cutting edge with social media is important. Staying on the cutting edge of all sorts of things is important too. And I know that everybody has got, things they're working on, there's innovative things happening, and you were telling me that really in your area, you're kind of getting your toes wet on social media, and I think a lot of your colleagues are in that place right now. They're just kind of figuring out, how do we work with this?
Yeah, it can be scary because, we're a department of two, and so I had to just jump because, you hear about it, this is the way it's going, so you just, it's like the commercial, just do it.
Yeah.
And you just try to learn as much as possible. There's groups everywhere. Talk about social media groups, and so you can go learn, and there's a lot of stuff online. You can use NPHIC and the CDC, so you can't be scared, you just got to do it.
Right. And what I love also is NPHIC has got some cool things that it is doing, some partnerships. In fact, in just a minute we're going to tell you about a partnership that has to do with really being better prepared for emergencies. But I know you guys are immersed in innovative things. Brian, what kinds of things are you working on now that have you fired up?
Well, I'm fired up along the same lines, looking at apps especially.
And that's fired up, not fired. Okay. Just want to make that clear.
In addition to the videos that we're doing and tailoring videos to something very specific, where as of next week we're going to have our Recovery Month videos, and then we'll be doing Holiday Blues. But I'm also really fired up about the apps. This is one area where I'm really learning how to use apps, not only for public health, but in behavioral health, which is the division I'm in specifically. And Salima, with the Georgia Department of Public Health, they've moved on this, and they've got a contract with Georgia Tech. And Salima has agreed to give a presentation to some of our staff people so we can see what they're doing, and I think it will be very exciting.
Ooh, sounds good. Way to go.
Yeah, it's just one of the many things we've got going on. I think something really cool and innovative that Georgia's doing, while you might not think it's communications related, but it's telehealth and telemedicine.
Yes.
And it's kind of, the new technology, the new way to use mobile solutions, iPads and apps. What we're doing now is we're expanding access to all of our, community members out in rural areas across the state. Everybody thinks Georgia, they think of Atlanta, but they don't realize that there's a lot of areas where they don't have obstetricians at all in their counties. So what we've done is we've connected like a little video cart. You'll have a mobile cart where you connect with a monitor, you have a camera, and you have your little remote control, and when you turn that on, kind of like Skype in a box, but it's a little bit bigger. When you connect and turn that on at a local health department, you'll be connecting with subspecialists in the Atlanta metro area or someone from a different state, a physician, who could give you that treatment. So we're doing a lot of high-risk OB clinics with that. We're doing teledentistry via video camera, and the physician is actually in a totally different place, not there with you, just with the nurse next to you, kind of. So it has a general exam camera. They can look in your ears, your eyes, your ears, your throat, and they can do an exam and or do a dental cleaning and exam and treat these kids.
That is amazing, the level of technology that we've got nowadays. And of course, we've all heard that there are apps on the horizon. Who knows what the new, a new iPhone or a new Samsung or something is going to let you do as far as monitoring your health, reporting to your doctor. And it sounds like you guys really have some cool things going there.
We're working on it. We're really excited. Our emergency preparedness people in the crisis communications team, like we like to say, always have like the iPads and the flip screens, and everyone's like, well, what else can we as physicians and as health departments do with these cool gadgets? So we're kind of finding a way for them to get used to them and start expanding and learning a little bit more about them.
Yeah.
Well, Kerry, that again speaks to the importance of NPHIC, because Salima's in downtown Atlanta. My office is in Midtown Atlanta. And by working at the booth together and listening to what she's doing and talking with Porforio, you really get to see what others are doing and learn, and people share information, and that's one thing I like about NPHIC. Nobody is holding it to their chest. They really share this information, and it benefits everybody, and we would never have these kind of opportunities if we weren't here.
That's good.
And when you come here, people say, here's my business card, give me a call, and realistically you wonder, do they really want me to call them?
And they
we
do.
encourage people to call us, and they call. You use use the business card and you make the contacts that you need. So when you know you have a training, you're on a limited budget, you say, hey, do you think maybe you can get someone to come over here and share with us what you guys are doing? And later down the line, we'll return the favor. So it's really a networking thing, but you can get a lot out of it.
Right, exactly. And as far as innovative things too, one of the things that I like and that I think is innovative is I've been working a lot on how you can produce stuff on your handheld device, on your smartphone. And you can now do audio clips, you can do video clips. And take a look at this thing that I found here. I found this is a microphone from a company, it's called Rode. And Rode makes an iPhone, or actually a smartphone mic. It works with smartphones and particularly the iPhone. And here's what it is. It's a little lavalier microphone. So it is a clip-on microphone, and it's got the right kind of connector here for any smartphone, and particularly the iPhone, where it's got the 4 little connectors on the end instead of the 3 that you typically see. So it's the right one. It's powered by the phone itself, so it doesn't need a battery. This is not wireless. This is wired. But imagine being able to simply plug that into your phone and then go shoot a video with it, do an interview. I've actually got, because it's kind of a short cable, I've got an extension cable that I always carry with me. So that way you can quickly do an interview with somebody. And with many of the applications, like if you have an iPhone with iMovie, all you do is hit the upload button. It goes right to Facebook if you want it there. It will go to your YouTube, save it to your camera roll. And with just a little editing in iMovie, you can do a nice, cuts or dissolves only video. In fact, I've got a video like that on my, I just tweeted it out a little earlier today, kind of a behind the scenes of how we were doing this webcast. If you go to Twitter and just look me up, it's Kerry Shearer, KerryShearer, twitter.com/Kerry Shearer. One of my more recent tweets will be that behind the scenes video. So go check that out. So that's innovative. There's a lot of cool stuff going on. And as a matter of fact, one of them has to do with NPHIC and a partnership. So let's go over to Robert Jennings right now, NPHIC president. He is with Karen Terrell and talking about a new partnership that NPHIC has with Media Survival Group.
Thank you, Kerry. One of the things we talked about earlier is that NPHIC is going to develop more partnerships and would like to get into more partnerships. And during my presidency, I've been able to at least get one partnership that I'm very excited about, and that's a partnership with Media Survival Group. Today we have with us its president, Karen Terrell. And Karen, welcome.
Thank you, Robert. Appreciate that.
Well, thanks for joining us. And could you tell us a little bit about what this partnership will entail?
Okay. Well, we have been traveling around the country delivering this Homeland Security 2-day crisis response workshop. And we have noticed time and time again that public health is invited almost as an afterthought to a crisis response. And so this partnership is going to involve Media Survival Group trainers going into the NPHIC districts one by one and bringing our NPHIC members together with their police, their fire, their sheriff, their school systems, their hospitals. Those are the people who respond to the crisis, and we are going to get the public health presence right there from the beginning, help them form a team.
Well, Karen, that sounds all very exciting, but after 1 year, what do you hope are some of the outcomes?
Okay. Well, this is a 2-day workshop, and Homeland Security pays the freight. So in my dreams, at the end of this year partnership, we are going to have a long list of NPHIC districts who have come to the table, who have taken this class, who have formed teams in their community, and they have already tested it and it works beautifully. That's my dream of dreams. So what we want people to do, NPHIC members to do, is to either go to the NPHIC website or mediasurvivalgroup.com, either way, and you can click on the advice on how to actually sign up for this thing. Homeland Security will pay for it. It will come into the community and deliver a 2-day workshop to get NPHIC right in the center of things for the next crisis response.
For more information about Media Survival Group and how to get in touch with Karen, visit www.nphic.org.
All right, thank you, Robert, very much. Thank you, Karen Terrell. Also, MediaSurvivalGroup.com. There's information on there about it as well. So either place. That sounds good. So we are about to wrap up our webcast here. We want to make one more little pitch. If you are on the fence, we want to see you in Chicago next month in September for the NPHIC Symposium.
I think the NPHIC Symposium is going to be fantastic. It always is. They've never disappointed. I think this year we've got a lot of new innovative ideas and new people coming to present. I know I'm specifically interested in learning about the credentialing that I keep talking about. There's going to be a lot of different best practices and lessons learned. You know, CDC gives us a lot of really cool stuff behind the scenes exclusively before. So I know there's a lot of stuff you guys were mentioning you were interested in too.
Yeah, I was really piqued my interest on the toolkit. You know, those are things that make your job a lot easier. So if I can get a toolkit to help me along, make my life easier, and get out of the work and at a good time, and you know, that's great. A toolkit is great for me.
I'm excited about a lot of the topics surrounding mental health. It's really great to see NPHIC incorporate that, because a big component of public health is mental health. And that ties into Sandy Hook, the awful tragedy that happened in Sandy Hook. So what NPHIC is talking about, that, lessons learned, it's just going to be fantastic. I went to my first conference last year in D.C.
The first time last year?
The first time was last
Where
year.
have you been?
I know.
Seriously?
Oh, man.
And it was mind-blowing. You know, I learned how much I did not know. And so you won't get anything other than this. So.
And we can't forget our awards. We're getting a lot of NPHIC awards. All of our members get to submit awards and entries, and we're going to find out who's the winner, who's got the coolest, most innovative public health.
That's right.
And the good thing about the awards, because they have a room where you can see what other people have done, who's been nominated. That's the best educational experience you can get.
That's
take
right.
a look, what are people doing in different parts of the country?
And particularly if you happen to have your briefcase with you, you just kind of scoop it in
Take
there.
a couple in there.
And you make it work for you. I mean,
I do. I've done my best networking after those sessions. So I'll go back and see who's posters, and then I start picking up the phone and saying, I need that toolkit, I need that, share it with me.
People
Give it right
share.
now.
That's what, I have to admit, after the last NPHIC conference, people called me, and we've talked and we've communicated. And that's the best part of it.
Great. Well, we're excited about that. Just go to NPHIC.org to sign up for the conference. You'll see a drop-down menu box there on the conferences. I think we've still got this conference featured prominently on the homepage. But NPHIC is really your resource for public health communications, and we hope that you are able to join us at the conference. Well, we're going to wrap up now. We have gone, this is our longest one ever. We've gone an hour and 11 minutes so far. So great job, you guys. It's been nice having everybody here. And Porfirio Villarreal from Houston Department of Health and Human Services, thank you for being an inaugural guest here.
Thank you.
Welcome. You're welcome
fun.
back anytime. Also, Brian Williams, Program Development Specialist, Fulton County Department of Behavioral Health and Developmental Disabilities. It's been great having you.
Thank you. It's been a pleasure.
And of course, Sulema Salgado, Telehealth Director, Georgia Department of Public Health. You have got so many things going on there, so I bet you're going to go back and just launch into it all.
Oh yeah, I'm ready to go in there and get with the team and tell everybody what they're doing.
The fall season is coming up. A lot of programs and things, involved in kicking off. And once again, thank you so much for watching our live webcast here. I want to give a shout out to Joe Rebele. He is our NPHIC IT guy, and boy, he had it dialed in. We had a really nice connection here at the hotel to give us all the speed we need, and thanks for doing that, and also getting your questions over to us here. Danny Swain on camera one. Oh my gosh, we have not had a live camera operator at every one of these, and it's been great having Danny on camera one. Thank you so much, Danny. Great job. And also over at the booth there, we got Christine Smith. She's been hanging out. She's been talking to all sorts of people, and she is also, Chris, you're our comic relief.
So true.
Can you get a shot of Chris over at the booth by chance, Danny? We caught him mid-gulp there with his Starbucks. Let me switch cameras here. We'll go over here to camera 3. I don't know if you can see her, but Chris, you got to give a wave to everybody there on the webcast. You're kind of behind the podium.
Wave, Chris.
And also, we see Laura Espino's head. Laura is the Executive Director of NPHIC. Stand up and wave, Laura. Come on. There you go. You get lots of emails and great information from Laura Espino. And Robert Jennings. Robert, stand up. We see you back there.
Oh, there we go.
NPHIC President Robert Jennings. So anyway, thank you so much, you guys.
I say shout out to Kerry, who's doing this fantastic thing right here. We couldn't figure out how to do it every single time. You always deliver, and I think